Welcome to Hotness, the podcast that brings you practical tools to balance your hormones and rekindle connection, confidence, and desire in midlife and beyond. I'm your host, Dr. Liz Lyster. Hotness is a safe space for honest conversations about menopause, sex, identity, love, loss, reinvention, and desire, because you can embrace your hotness at every age. My conversation today is with Amber Ross, certified physician assistant in the San Francisco Bay Area, specifically in Pleasanton. Amber has a functional medicine practice with a lot of overlap. She's also certified by the A4M, American Academy of Anti-Aging Medicine, as a functional medicine provider. So she has a great breadth of knowledge, a lot in common with what I do with hormones. However, she also brings a lot to the table. We had a very wonderful discussion about the gut in particular. She's one of my go-to colleagues for questions that are gut related. What testing, what remedies, what ways to help the gut. So you'll learn about the 4 R's to help the gut health, the estrobolome, a new up-and-coming word. And so please enjoy my conversation with Amber Ross. Hi, Amber. Thank you so much for joining me on Hotness. I'm very excited about the tools that you have that I know that you implement in your practice. So let you start us off. And I'd love to hear your own story of how your practice has evolved. And then I'm going to ask you more specific questions related to women in midlife and gut health. So we'll go down that road, but tell us a little bit about your story, please.
So, Dr. Liz, thank you so much for having me on. This is so fun to get to chat with you. So, I am a physician assistant, and I worked in family practice for about 18 years. And when I had my second child, after I had her, I had a little bit of baby blues and perimenopause because I was older, but nobody told me that. And then I tried to go back to work, and I just wasn't feeling it. It wasn't a friendly environment. I just was completely burned out on mainstream medicine, and I didn't feel like I was helping people as much as I would like. And so I ended up just going home and being a mom for a while, which brought me to my next stage of functional medicine, because then I had time to go back to school. And that's led me to be here.
Beautiful. And then you were saying to me about there was a point in your own practice where you felt burned out. Were you already what we would call midlife? I usually say midlife starts at 40. Hormonal changes are happening younger and younger, but can you share a little bit about what you pursued in your functional medicine training? What caught your interest? I know you deal with hormone balance, which people who listen and follow my stuff hear and learn and already know a lot about that. So we can work that into our conversation, but I know that you have other tools in your toolbox.
Yeah. So, I love functional medicine. I love looking at the body as an entire organism where everything's connected, right? Our gut has a lot to do with processing our hormones. And I know in functional and hormone practice, most of us feel this way, but we don't just want to sort of introduce hormones into a system that might have inflammation or gut problems, because then they're not going to be getting the best use out of their hormones. So we want to optimize things. We don't want to just put Band-Aids on anything. And so I feel like once we start working with people and their issues start coming up, it's not necessarily hormones. Hormones is the starting point, which leads into everything else. And so a big part of overall health, though, I would say is the gut health, because that's where most of our immune system lives, 80% of our immune. And then if people are not releasing what comes in and things are backed up, then things can become toxic. And then, that's not good for us overall. So we want to be mindful of the gut health with movement, with balance. And we really like to get into that here at my clinic.
Are you talking about overall movement, like exercise and that type of movement, or like the bowels moving? Because that's important too.
Both.
All of it. Okay, we want everything moving.
Our bodies and release what's not serving us, release like our bowels, move our bodies. It's a whole body, that we look at. And so with hormones in particular, they are so powerful. I mean, they have such amazing effect on everybody. But that, I think, is the difference between the functional versus what we do as functional rather than conventional, is we're not just kind of like writing a prescription, like, here you go, good luck. We're sort of managing all of the different areas that the hormones might touch.
Yeah, absolutely. Which, of course, is the entire body. There's no part of the body not touched by hormones. And as I always like to say, being a woman in midlife is a whole body experience. So, yeah, so there you have that. First of all, what do your patients usually present to you with? What are they complaining of, or what symptoms are they having when they arrive at your practice? And then I want to talk and ask you more specifically related to the gut. But what types of symptoms are we talking about?
So usually when women show up to us, they're just exhausted. They can't get through the day. They're having hot flashes. They feel terrible. And they also feel like no one's listening to them, and they've been told that they're making up things in their head. This is just normal for this time of life, and it's emotional for them. They feel like there's nothing left for them, and this is just how it's going to have to be.
Right.
And so when they feel, they've been told this is normal. And so when we tell them it's not normal and there's something you can do about it, the relief that just washes over their face.
They're like, oh, yeah.
Yeah, that's amazing. And then just to see them change, I mean, it only takes 3 or 4 months until they're kind of like a new person. And
Beautiful. Let's do a little more specifics of the gut and inflammation, whichever order you want to tackle those in.
Okay, so I feel like inflammation is just part of being alive these days, because we get so much. We live in an industrial civilization. I mean, we're exposed to microplastics, pesticides, and this is just a fact. I don't think anybody would, say that wasn't true. But what becomes an issue with hormones in particular is that it creates a barrier from the hormone to get to the receptor. So the hormone is like a key and a lock. And if the receptor has a bunch of junk in front of it, the hormone can't push through. It's really going to impair the body's ability to accept that hormone. So I know for us, we do a detox with our hormone patients to try to clean that up so that the hormones can do their job.
Yep.
And
awesome.
then gut health is a similar issue, but then we're dealing more with microbes and cleaning that up.
Do people I hear a lot of women sometimes, even in my practice as well as otherwise, right? Women talk to me about these things all the time, that they feel inflamed, like they're having joint pain, that type of thing. So is that what you're talking about when you talk about inflammation with your patients? Because I don't necessarily see it as exactly the same thing. Sometimes their inflammation markers will be okay, but they're still having the sensation of inflammation. So anything else that you talk about with women when they come into your practice, midlife women, when you're assessing them for inflammation, and what other types of questions?
I would say insulin is really high on the list, because if that insulin is dysregulated and people are spiking their glucose, which is really common with our American diet.
Yes, the sad diet, the standard American sad diet.
Sad.
Very sad. It is sad.
I explain to people that insulin is kind of like the tip of the iceberg. Like, until that insulin gets regulated, nothing can really stack below it properly. And so we spend a lot of time talking about nutrition and, not that carbs are evil, but we like people to eat their vegetables and then their protein and fats and then the carbs at the end to kind of sneak it in so it doesn't spike that insulin.
Yep.
And people taking control of keeping their insulin balanced is a huge part of hormones, right? Because that insulin's dysregulated. It can also make your cortisol, your stress hormone, go up.
Right.
As well.
Yeah. all this chicken and egg, right? We don't know which is causing which. Okay.
Mhm.
And what questions do you ask to assess their gut? And testing? Do you do stool testing particularly? Do you do that on everyone? What do you do initially to assess
Okay,
the gut?
so we have a very basic program that does not include testing, and probably 80% of people will feel better with it. We do a 4R program, which is remove, reinoculate, replace, rebuild. And it's basically
Say a little more about that because I've heard those 4 Rs, but say them again and what each of them means.
Yeah, so the first one, and honestly, as we get into more sick people, we almost need to reverse the order that we're doing it because
Okay.
the rebuilding, the rebuilding is so important.
It's not a
But
one size fits
traditional
all. That's good. Mhm.
kind of 3 to 4R is going to be remove the pathogens. So most people do have overgrowth of yeast in their bodies from eating sugar, and most packaged foods do have a lot of sugar. And so most people do have a candida overgrowth. They can have bacterial overgrowth. They can have parasite overgrowth, which is really common. Like you would think that's so weird, but it's really not. And so we have an herbal blend that works really well. I've tried all of them, and this one seems to be the best one. We
It's a supplement or a powder or a drink.
it's a supplement.
Okay. Okay.
The very first thing that we do is we do an elimination diet and a
Okay.
liver cleanse to make
Okay.
the path clean so that when we do the killing
Beautiful.
phase, they have somewhere to go. And so
Okay.
we have to make sure people are able to go to the bathroom. That's really fundamental and shockingly common that people can't.
Yes, I want to ask you more about that, but keep going with the R's. Let's do the R's and then let's talk about that because I think it's even more common for women in midlife. Of course, we go through different phases. Pregnancy can be a difficult time for keeping the gut moving. Also, a lot of people on GLP-1 receptor agonists now. So it's really important. We'll talk about the gut moving, but okay, so we've got the 4 R's. First was remove. That's awesome. Removing offending things that we take into the body, but also making sure the elimination is working. Okay.
Yeah. So we remove, eliminate, get rid of the bad stuff, and then we reinoculate. So then we're putting the good stuff back in.
Okay.
And then we basically need to rebuild the lining because the rebuild, and that is like a butyrate, like immunoglobulins, and that is going to strengthen that gut wall because the gut wall is only 1 cell thick.
Right.
And so it's really easy to make it porous and things can go in and out.
Yeah.
And so it's really supposed to be the pipe, like inside and outside are separate. And so it's really important to keep it that way. And so I would say in our practice, we don't even check food allergies until after the gut program.
Excellent.
Because if we check it the first week, it's going to be lit up like Las Vegas. And then people cry because they can't eat anything.
I got it. That's great. I love that. Okay.
And then if they don't get better, that's when we do the gut test and we can send it out and have it looked at.
Got it.
Pathology.
Yeah.
And then we can dig deeper into medications.
Cool. That's very cool. Okay. Did we do the 4 Rs? Remove, reinoculate, replace, and rebuild.
And rebuild. Mm-hmm.
Beautiful. I love that. Okay. Tell me if kombucha is actually good for people or not. People ask me this question. I'm not a fan. I just don't like how it tastes. And I know I've seen patients who just absolutely love it. And then they have so much of it that their blood sugar goes out of whack. So, and when I heard you say reinoculate, I'm like, okay, because that's where people think about certain foods that some people can't tolerate. Certain dairy products, yogurt has certain organisms, strains, etc. So start with kombucha and then other.
Well, I follow Dr. Jill Carnahan, and I've seen her speak before, and she's not like kombucha.
Okay.
She thinks it's some wild thing that just grows and people don't know anything about it. And like, why would they introduce that to their bodies? I personally don't like it. Like, I don't have a flavor for it, but I know people like it. And if that's the one thing they do that's healthy, I'm probably not going to tell them to stop.
Right. Got it. I totally agree. I totally get that. All right. So we both kind of feel the same way about that. So I'll find somebody that I'll talk with on the podcast at some point who's like a big in favor of it. And then we can
yeah,
say,
let me know.
we can like, well, we'll learn more about
But
it.
we have sauerkraut, we have kimchi, we have such like in Latin countries, there's like the pickled carrots and peppers, and like every culture has some kind of fermented food, really.
Okay. So that's what we're talking about with reinoculate is fermented
foods.
that we
also have specialized like medical strength specific probiotics that we like targeted probiotics that we can use.
Yeah, that's a whole topic. Maybe we'll do an entire recording another time talking all about that because they're so specialized. There's so much to talk about.
Mm-hmm.
Let's talk about constipation because I really think that with the hormonal changes that women in midlife go through, and I've experienced this myself.
Me too.
With the slowing down of the gut. And also, I know this is more common in women than in men because when I've gone for my colonoscopies when I turned 50 and when I turned 60, and the GI doctor talked about this with me, that the colon is just more relaxed and it doesn't move as well. So say a little bit about that. What do you see about that? And what do you have women do to get things moving? There's a lot of products out there.
Mm-hmm. Yeah. So with constipation, there's so many factors. A hydration level, fiber level, is your gallbladder working? That bile is so important to have enough. And oftentimes that will be the answer, is giving them something with like a bitter, like an artichoke kind of a base to stimulate that contraction. It is a tough thing to tackle because it does slow down, and people think, oh, this is normal, but it's really not. I mean, they've done studies showing women who are more constipated are more prone to cancer. So it is really so important to relieve that.
And that makes sense because like you said at the very beginning, when we're not eliminating waste products. Our bodies, our cells are metabolizing all the time, and the waste has to go out either in the urine or the gut. And for hormones, the gut is the main route of eliminating those waste products, the byproducts. So,
you don't want estrogen just cycling in your body.
Yeah. You took me right where I wanted to go, which is a word that is a relatively new word. Of course, it wasn't around when I was in medical school, but that was, when dinosaurs roamed the earth. So the word estrobolome. Most people have heard the word microbiome. We have microbiomes everywhere, in the gut, on our skin, in lots of places. But now people are using the word estrobolome. So say a little bit about that and how that connects to what we're talking about in the gut health.
So this is a word that will come back on a stool test. So if you were to do a functional stool test, you would get a special little paragraph about how their estrobolome is functioning. And what it means is there is a family of bacteria that it's their whole job to decide whether to keep that estrogen cycling in your body or to get rid of it. And so you don't want it to be too high or too low. You want it to be just a Goldilocks in the middle. And the best way to do that is to have good gut health. It's really interesting how the two things, the gut and the estrogen and hormones, do all this crosstalk, really.
Yeah, wonderful. Yes, and you and I met through the Bioidentical Hormone Provider Training Academy. And so we have learned so much, right? We have volumes of materials related to hormones.
Mm-hmm.
And we're just doing this short tip of the iceberg conversation today. So I'll look forward to more. What else are you really passionate about exploring? In addition, you got a woman in midlife. I know you take care of people of lots of different ages, but for women in midlife, this podcast is for feeling great, feeling, hotness as in not just hot like the hot flash, which that can happen, but we like to help people not feel those. But we want to feel hotness like from a libido standpoint, and we have to feel good energy for that to happen. There's a lot that goes into that. So what else do you talk about that brings us back to that and other topics that you're passionate about that we can just bring up?
Oh my goodness. Well,
I know.
Reading someone's hormones and that really, I feel like in your 50s, maybe like late 40s, 50s, all the chronic stuff kind of starts coming up. And if you can tackle that in that decade, you can really prevent things from becoming chronic. And then you can actually start to reverse it a little bit. And so I love seeing people, they come in and they have dry skin and wrinkles and they're like that tire around their belly and they just feel horrible and they're not feeling like they look very good. And then after about a year of being on hormones, like they get their waistline back, their skin looks better, they're glowing, they have energy, they have a libido, they get their little sparkle back, and they rekindle their relationships with their husband, and they just get their zest for life back. And it's so wonderful to see that.
Yeah, beautiful. I love that. Yeah, because libido isn't only about sex, it is zest for life. That's one of my favorite definitions. And I know, just to touch on this just a little bit, getting a little more personal, I know that you've been through things. Your daughters are now old. Are they both older teens?
I have a 15-year-old and a 19-year-old. So
okay. All right. That's what I thought. Yeah. So there's a lot involved in being in midlife and being a mom and being a wife, being a partner. And so what would you share that's made a big difference for you, right? I like to share tools with women. I know you've used lots of different tools, including hormone replenishment and gut health and all those things that we do that we talk about with other people. Anything else that has been helpful to you in terms of keeping your own spark alive while you're doing everything that you do?
Oh my gosh. Well, I would say doing my pellets with you has been a life changer, because that little bit of testosterone gives me so much drive and I can manage my life. Whereas before I was kind of a mess and I just felt like I was all over the place and I couldn't see things through to the end. And now I just have I can do it all.
No.
And that's a huge gift. But I mean, it also gives me the energy to do the self-care that is needed. I'm able to finish my tasks so that I can go to my yoga class and I can walk the dogs and I can go outside and just take in the sun for a little while. And I have bandwidth to get to that. Whereas before I might not have, all my bandwidth would have been used up just on the day-to-day tasks.
I love it. I love that. Right. We love testosterone. It really helps women draw boundaries. That's what I'm hearing when you're having a boundary around work, right? You own your own practice. I have my own practice, and we have to be able to draw boundaries so that we can go and, like you said, do those self-care things. So that's really fantastic. As I always say, you and I could really talk for a very long time. But what I want to also leave our listeners with is, how can they reach you if they want to learn more about your practice? I'll put the link in the show notes, but what is the best way for people to reach you?
I would go to my website, which is timelesswellnessclinic.com. And you can call our clinic, the number's on there, or you can fill out a little form, a contact form, and we'll get right back to you.
And you're in the San Francisco Bay Area.
We're in the Bay Area, East Bay specifically.
Beautiful. I love it. In person, telehealth, both? I
mostly do in person.
Nice.
I can do telehealth. It would be nice to at least meet in person once, but I have a few people that live too far for that, and I've been able to help them for sure.
Wonderful. That is so great. Well, I wish you the very best with your own hotness and your work that you do, which is so wonderful and important in the world. And I am giving you a hug across the video waves, and I will look forward to getting to speak with you again soon.
Thank you so much for having me, Dr. Liz. That was super fun.
You're welcome. Thanks for listening to Hotness. Help more women find these practical tools by liking, sharing, and following the show, as well as leaving a review. As a gift for listening, go to drlizmd.com/hotness for your free midlife guide filled with powerful support for your mind, body, and soul, because you can embrace your hotness at every age.